For many people, the question is, what is vision therapy? And vision therapy is really a process of developing the visual system. It involves visual challenges or activities that help to stimulate the visual brain. Many of the children that I see have been told that they have 20/20 eyesight and still have difficulty with binocular vision. One of the key areas of binocular vision is the ability to use the two eyes to align and sustain convergence. That skill is very important when it comes to reading, whether it be a book or working on a computer. So convergence insufficiency is a binocular dysfunction where the individual is unable to sustain the alignment of the eyes at near. That will many times result in an individual starting to experience word separation. Think of the individual who's standing up to hit a baseball. You're at the plate and you're looking at the pitcher. Pitcher throws the ball and you've got two eyes and you've got a line on that baseball coming closer to you. That function of looking at the distant ball as it comes closer to you, together with the two eyes, is convergence. Now take that a step further. Now we're talking about sustaining that convergence at 16 to 18 inches on a reading task. And when a child cannot do that, when an adult cannot do that, it makes it a lot more difficult to sustain the task that's required for reading. Another group of children with convergence insufficiency oftentimes will fight through the effort, but then internalize that effort into stress, which then manifests into headaches, often again associated with reading or classroom activities. The parents are actually often the last to hear about this because, in my experience, children who have this situation of difficulty with binocular ability, where images start to separate, will actually assume that everybody sees that way. Oftentimes also the ADD type of profile is described, where we see children who appear to have all the characteristics of ADD, but in reality have a binocular vision condition such as convergence insufficiency. So ADD behaviors are often seen with children who have convergence insufficiency because it just takes so much effort to sustain the near-centered visual task, and they just want to get away. And so they'll avoid reading. It will oftentimes be their least favorite thing to do, even though we have a child who may be very bright and actually knows the words if presented to them one at a time. When they have to read, though, for any length of time, they become tired or frustrated with that task. Often parents wonder, why does my child have this problem? And the answer is because they haven't developed these visual skills on their own through normal child development. Normally, we develop these abilities on our own. So there are examples where a patient can lose this function in binocular vision, often due to a concussive injury, a traumatic acquired brain injury. Now, too often, the standard eye screening doesn't look at binocular vision. The primary objective is to see if a child has trouble with seeing clearly. So it's important that a child have a comprehensive eye examination, that the doctor is especially in tune with the issues that center on binocular vision difficulties and does the appropriate testing. There are some things that parents and teachers can do to screen children to see if they have this basic convergence ability. And it's as basic as just taking a pen and using this as the test target, bringing it up to the child towards the bridge of their nose, and seeing if they can converge their eyes on the target. What we're asking the child in this particular test is just simply to converge their eyes, look at the tip of the pen, and tell me when it goes double, when they see it come apart and go to 2. And it should be single right up to about the 2 to 3 inch mark. Vision therapy is an effective treatment process because we're working on developing the visual system, utilizing the principles of neuroscience. The visual system develops through learned experience. And in vision therapy, we utilize those principles to help our patients improve in their visual ability. So when we work with our patients with binocular vision problems like convergence insufficiency, our treatment plan is divided up into portions. It's like a lesson plan. Some of those parts deal with tracking, fixating from spot to spot, focusing to be able to adjust the eyes in a way that is the strength of focus and agility of focus and accuracy of focus. And then within binocular vision, we're helping the patient to acquire the ability to fuse and then the ability to take it into the next phase, which is 3D vision. That's called stereopsis. So stereopsis, or 3D, is really the final stage, which is the benefit of using the two eyes as an effective team. So let's take, for example, the Brock string. The Brock string is really simply a string and 3 beads. But how we use it in a vision therapy activity is we have the patient take the string, hold it on the end of their nose with the 3 beads suspended along the way. What the patient is asked to do is to look at one of the beads on the string. When they're using the two eyes together, they'll see the 2 strings, and their objective is to see the strings pierce through the ball, the target that they're looking at. So if the bead they're looking at is in the middle and the strings converge and cross right through that spot in the middle, then that's feedback that they've actually aligned their eyes in that point in space. And with the feedback, then they can use that information or that sensation to align their eyes on the object. One of the core elements in every vision therapy treatment plan is loading. And one of the things that we do with our patients is to integrate vision and balance. So when we help our patients to develop these skills in binocular vision, we'll oftentimes have them standing, balancing one foot in front of the other. We can even put them on a teeter board. The reason is when you incorporate the balance centers of the brain, it helps to speed up the areas of development in the binocular areas of the brain and these other functions that we're working on. In order to help our patients gain the best experience while vision therapy, we utilize the latest technology. And one of the latest tools that we have is the Sanit Vision Integrator, the SVI. The beauty of having the Sanit Vision Integrator is we're using a device that creates challenges that work on eye movement, eye-hand coordination, and the ability to see centrally and peripherally at the same time. In the example of when we're working with patients in 3D vision therapy activities, what we're doing is organizing activities that have a way to control the way each eye sees. At WOW Vision Therapy, we incorporate all of these areas to help our patients experience that 3D effect by developing their binocular vision. So what we're doing in this therapeutic process is we're helping our patient develop these skills that they haven't got when they begin treatment. It's at an unconscious level. They don't know how to use those abilities. We help them develop the skill to a conscious level and then ultimately to the automatic function, so they don't have to think about it. That automatic function is where they are completed the treatment process and the skills are therefore retained lifelong. So for those who are teachers working with children, you can see those who struggle. You can see those who are bright and yet not able to perform. Oftentimes they're the children who look like they've got the ADD type style or behaviors. For the children that are just inefficient in their reading. It's important that these children be at least tested for binocular vision difficulty. So as our patients begin to develop their vision, some very interesting things start to take place. The double vision or the image overlap goes away. The pattern of headaches diminishes and fades away. There's a sense of confidence that emerges because the negative emotional associations with the things that used to be a problem for them go away. Often with the children that we see, they have difficulties in these areas. Those avoidance behaviors that used to be, I can't, become, I'll try, and then I can. So you see this change in behavior, this blossoming that takes place as confidence emerges. And for those parents who are trying to find a doctor in this specialty, developmental vision therapy, I encourage you to go to the College of Optometrists in Vision Development's website, covd.org. There's a doctor locator there, and you can find a doctor nearest you who specializes in this area of vision care. So find a specialist in your area to find the help that you or your child needs, because life takes vision.